If sugar raises blood pressure, why do people who eat more fruit consistently have lower blood pressure and less heart disease? Today we are going to talk about why whole fruit doesn't actually raise blood pressure. Fruit contains sugar. Yet across decades of nutrition research, people who eat more whole fruit tend to have better cardiovascular health, not worse. This creates a clear contradiction between what many of us believe about sugar and what the data actually shows. So today, we're unpacking a common misconception: why whole fruit does not raise blood pressure, even though it contains sugar, and why avoiding fruit may actually work against long-term heart health. For years, we've been told that sugar is harmful for blood pressure. And in many cases, that's absolutely true, especially when sugar comes from processed foods and sugar-sweetened beverages. These sources deliver large, rapidly absorbed sugar doses with very little nutritional value. Because fruit also contains sugar, it's easy to assume it behaves the same way. But nutritionally and metabolically, whole fruit is fundamentally different from soda, candy, or desserts. To understand why, we need to look at how excess sugar can raise blood pressure in the first place. High intakes of added sugar, particularly in liquid form, can raise blood pressure by increasing insulin resistance, raising uric acid levels, promoting low-grade inflammation, and increasing sodium retention in the kidneys. Together, these effects impair blood vessel function and increase vascular resistance. Over time, this contributes to higher blood pressure and increased cardiovascular risk. But here's the key point: these effects are both dose-dependent and context-dependent. And this is exactly where fruit changes the equation. Whole fruit contains sugar, but it also comes packaged with fiber, potassium, water, vitamins, and bioactive plant compounds. These components dramatically alter how sugar is absorbed, metabolized, and how it affects the cardiovascular system. First, fiber plays a critical role. The fiber in fruit slows digestion and sugar absorption in the gut. This blunts blood sugar spikes, reduces insulin demand, and lowers stress on blood vessels. Slower absorption means the body can handle the sugar efficiently without triggering harmful metabolic responses. Second, fruit is one of the richest natural sources of potassium. Potassium is a powerful blood pressure-lowering mineral. It helps the kidneys excrete excess sodium, relaxes blood vessel walls, and improves vascular responsiveness. In many cases, potassium directly counteracts the blood pressure-raising effects of sodium. Third, fruit has a very high water content. This reduces the overall sugar density of each serving and lowers the metabolic load compared to concentrated sugar sources like juice, syrups, or sweetened beverages. Together, these factors explain why fruit sugar behaves very differently from added sugar. And this difference shows up clearly in real-world data. Large population studies consistently find that higher fruit intake is associated with lower systolic and diastolic blood pressure, reduced stroke risk, and improved endothelial function. These associations hold true across different age groups, populations, and dietary patterns. Importantly, these benefits are seen even when body weight remains stable. In other words, fruit can improve blood pressure independent of weight loss. Randomized dietary trials also support this. When people increase fruit intake as part of a balanced diet, blood pressure markers often improve, even without reducing calories or carbohydrates. If fruit sugar raised blood pressure, we would expect to see the opposite pattern. But again and again, the evidence points in the same direction: fruit is protective. What about fructose specifically? This is another common concern. Much of the fear around fructose comes from studies using very high doses of isolated fructose, often far exceeding what people would consume from whole fruit. These studies are useful for understanding mechanisms, but they do not reflect real-world eating patterns. In whole fruit, fructose intake is relatively modest, absorption is slowed by fiber, and potassium improves kidney handling of uric acid. Because of this, fruit consumption does not appear to raise blood pressure in the same way as sugar-sweetened beverages. In fact, several studies show that replacing sugary drinks with whole fruit is associated with lower blood pressure and improved metabolic health. Context matters. That said, there are some situations where individualized guidance is important. People with advanced kidney disease may need to monitor potassium intake. Those with severe insulin resistance or rare fructose malabsorption may also require tailored dietary strategies. But for the general population, including people with hypertension, whole fruit is consistently associated with better cardiovascular outcomes, not worse. This brings us to the bigger picture. Fruit doesn't protect blood pressure because of one single nutrient. It works because of the combination. Fiber slows sugar absorption. Potassium supports blood vessel function. Antioxidants reduce inflammation and oxidative stress. Water lowers metabolic burden. This is why modern nutrition science focuses on whole foods rather than isolated nutrients. The food matrix matters. Avoiding fruit out of fear of sugar may actually increase cardiovascular risk by displacing foods that support vascular health, kidney function, and blood pressure regulation. The takeaway is simple. Whole fruit is not the enemy of blood pressure. For most people, it's one of the most consistently protective foods for heart and vascular health. This video is for educational purposes only and does not replace medical advice. Always consult a qualified healthcare professional for personalized guidance. If this video helped clarify the science behind fruit, sugar, and blood pressure, like the video, subscribe for more evidence-based nutrition content, and share it with someone who's been told fruit is bad for their heart.